I'm here with Chris White, who's an Clinic Liaison Officer, or ECLO, at Queen's Medical Centre, Nottingham University Hospitals. So Chris, briefly, can you explain to me what is the role of an ECLO?
Primarily the ECLO is there for supporting the patients. It's a very varied role. It covers everything from people who are newly diagnosed. They may have had something explained to them that they don't understand, so I'm there to put it in terms that they can understand. I'm there to give initial mental health support to people. I'm also there to deal with the certification and registration process when people become sight impaired or severe sight impaired, and I process the paperwork for that and make sure they get the right kind of support, and their referral is passed on to the local authority. Basically, the role of an ECLO can be a bit of a frontline counsellor, because you're meeting people at their most vulnerable. You know, they've just been told you've got a sight problem, that means you're going to be certified as sight impaired or severe sight impaired, and that can be a real knock to everything that you are. So initially I will let people talk to me, ask me questions, and I will try and see if any outside service can help them. So referrals into counselling, maybe it'd be back to the GP to refer to counselling, or I can refer to other counselling services as well. But initially, when they first come to me, you're a bit like a rabbit in the headlights. You've just had this shocking, awful news. So I give people enough time, basically, to come to terms with things, and then I'll call them a couple of weeks later and say, do you want to talk about how you're feeling, you know, what's going on, and see if I can arrange something for them, so I can refer onward for specialist services. When people reach the level with low vision that they can't read N16 on a near vision chart, they should be offered a low vision appointment, which can be done by the consultant at the hospital. There's a bit of a wait at the moment, but once they get through to the low vision service, they will be assessed for a magnifier. There are about 5,000 different types of magnifiers, so it's important that you get the right one. After the assessment, you will be given a magnifier on a long-term loan basis. There may be some other equipment that you may be offered as well, things like overshades for your eyes, TV glasses. There's a kind of glasses called near and far as well, and they're issued by the low vision service. The advantage of that is that if ever in the future you needed a stronger magnifier, you can always go back to the low vision service, be reassessed and swap it. Once you reach a certain level with your sight loss, you'll be offered, hopefully, certification by the consultant. There are two different layers of certification and registration. Certification happens at the hospital, and that's when the consultant decides that you fit the criteria to be registered either as sight impaired or severe sight impaired. He then fills in a form. That form then comes to me and I process the form. So the patient initially is certified. That form then goes off to the local authority, and the local authority are responsible for the registration process because they hold the register. And it's the patient's choice whether they want to be on the register or not. There are no real disadvantages to being on the register, and there are quite a few advantages to being on the register. Once you're certified, and the form goes off to the local authority, it acts as a statutory notice of need. So the local authority have to get in touch with you within a couple of weeks and arrange to come and see you, usually in your home, and discuss any rehabilitation that might take place. They have specialist people like rehabilitation officers of the visually impaired, or visual rehabilitation specialists, which is the new name for them. And they will advise on everything from cooking a meal to getting out and about and accessing the community, and make sure you do it in a safe way. I can refer patients to national and local organisations who are sometimes generalised but sometimes quite specialist in their support of people. For instance, the Macular Society support people with macular disease, Retina UK, they support people with retinitis pigmentosa, Usher syndrome, those kind of things, and rare retinal diseases. And Glaucoma UK are there for support of people with glaucoma, whereas the RNIB, they're not condition specific, they will support anybody who has a visual impairment. So locally we've got My Sight Knots. They provide a range of emotional support and practical support. We have a team of sight loss advisors who can help you learn how to get the best out of life with your sight loss through equipment, technology, useful tips and advice on living with your eye condition. You can also meet other people through shared vision and hear about how their journey is going, and they share your experiences as well. They can always give handy hints and encouragement and confidence to adapt to your new way of living. We can also give support for people who have maybe they're missing out on hobbies like arts and just social engagement and things like that, and technological help as well. There's a lot of technology out there that can help massively, especially with the new smartphones and tablets and computers. They've become very, very accessible with new software that's available. The right time to be referred to an ECLO is if that patient is struggling. It doesn't matter if they're not certifiable. They can be newly diagnosed. They can still have good vision in one eye. The best time to refer is as soon as possible. As soon as that patient is struggling and they need some help, they need some support, that's the time to refer to us.
Why is it important that patients get the support they need when they're dealing with sight loss?
It's massively important. Mental health problems, people with a visual impairment are 40% more likely to have mental health problems. So getting them the support at the right time, the time that they need it, that makes a massive difference, because supported patients do better.